Today, we're going to talk a little bit about sprained ankles. This is one of the number one injuries that my patients come into the office for. One of the most important things, I always like to review a little bit of anatomy with the patients. When patients have sprained ankles, we're dealing mostly with the ligaments, which is what holds bone to bone, versus what a tendon is, which is a muscle held on by a tendon inserting into a bone. So when we're talking about sprained ankles, we're mostly talking about ligament injury. Usually the sprained ankle is an inversion type of injury where your ankle will actually be twisted in. And patients immediately have pain, they have inflammation, they can have bruising, tenderness, and some patients cannot even apply weight to their foot and ankle. At that point, that's when you should be seeing your doctor or going to the nearest emergency room for evaluation. When the patients come into the office with an ankle injury, I usually like to order an MRI so I can further assess the ligamentous and soft tissue damage. Because the x-ray will only show me the bone, I need to see a little bit further so I can treat the patient accordingly. Normally, my patient will be placed in a cam boot, and depending on the MRI results, they will be in a non-weight bearing or in a protective weight bearing status. Patients will be immobilized anywhere between 4 to 6 weeks, depending on the severity of the injury. After we deal with an ankle injury as the sprained ankle, it's very important afterwards to maintain prevention and continue with home exercise programs, warming up and then stretching before you exercise, and of course, following up with your doctor if you have any other complaints.